Welcome to the Vitality Vault Podcast, your one-stop shop for health and wellness. Join us as we dive deep into the latest medical trends, break down complex health topics, and empower you to live a more vibrant life.
Hi there. I'm Dr. Bacchus Morris, a triple board certified physician who specializes in internal medicine, obesity medicine, as well as anti-aging, regenerative, and aesthetic medicine.
Hi, I'm Dr. Gerald Morris, and I am a double board certified physician in internal medicine and obesity medicine with special interest in peptide therapeutics, which I got certified in.
Together, we're passionate about helping you achieve optimal health and longevity. From exercise, nutrition, we'll be bringing you the latest cutting edge in terms of weight loss and everything else in the wellness world to help you achieve a healthier you.
So our goal is to help you live your best life. So whether you're looking for weight loss strategies, longevity, just want to live a little bit better, and have these tips that you can apply to your daily life from day one, we are here to help. So come join us on this journey.
Join the doctors, voted top internist in Tucson 4 years running. So let's unlock your potential together. Welcome to the Vitality Vault Podcast with Dr. B and Dr. G.
Hi there, everyone. Well, welcome to another episode in our Vitality Vault podcast. I'm Dr. B, and I have the famous Dr. G here.
That's me.
And we're about to see which sock he's wearing today.
It's sock time. So today, in honor of our topic which you'll hear about, I actually have what is a syringe, the sign for medical establishment, and a rhythm strip from an EKG. So this is my EKG socks.
Hopefully it's a normal strip.
No, this person's on their way out. I'm sorry. We tried our best. We couldn't save him.
I guess this person had hypertension.
He had hypertension. Yes, he did. And that, by the way, is a topic for today in our list of primary care conditions that we treat: hypertension.
Yes.
High, or
which is a fancy way of saying
high blood pressure. I like hypertension though. It sounds sexy. Yeah. So we'll stick with that. It's fancy. So, Dr. B, tell me, is this something that you treat commonly in your practice?
I think day in, day out. Absolutely. One of the first things that they teach you in med school.
Yes.
Because it sets the pace for other medical conditions as well, too. And it's one of those things, if it's not caught early and treated properly, can cause so many problems down the line.
Silent killer, as we were taught, because like you said, it just tick, 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 and when you finally can feel your pressure, it usually is a little bit too late, depending on what's going on. So let's dive in. So some stats for you, Dr. B. So did you know that 1.3 billion people in the world, this is from WHO stats, in the world suffer with elevated blood pressure? Or hypertension. That is literally, I did the math. Simple math is my thing. Simple math. 1 + 1 = 1. That is literally about 20% of the world's population, if you think about it.
Almost 20%, yeah.
Definitely people who just have hypertension. And by definition, you can have pre-hypertension and you can have bold-faced hyper, which is regular old hypertension. With pre-hypertension, anyone with a blood pressure of 130/80 or a little bit over 130/80. And then full-blown hypertension is when you're definitely above 140/90. So this is something when you go to your primary care doc, they always do vitals. We always check our blood pressure because we want to know what's going on. Because like we mentioned, it is one of the most important silent killers that we tackle on a daily basis as primary care physicians.
And these blood pressure readings need to be consistent for it to be called, whether it be pre-hypertension or hypertension. Because once in a while, we'll drink too much caffeine or, check your blood pressure right after you exercise, something like that. That may cause the elevation in the blood pressure, but it's a consistent reading of that. So typically, if someone comes to the office and this is the first time blood pressure is elevated, I would recommend they come back for a check, or definitely, if they don't have already, get a home blood pressure monitor, and check regularly, keep their logs and bring it in. It may be the start of some blood pressure issues, or it may have just been that day. So consistent readings is what we're looking for to give this diagnosis.
two types. There's primary and there's secondary. Primary obviously is the essential, which is, you really can't find a true cause, so to speak. And secondary, there's something else ticking in the body, whether it be an endocrine disorder, a cholesterol issue, diabetes, something else that's triggering the hypertension. Now, symptoms. Like I said, silent killer. So often it's asymptomatic, but some patients, when it gets really bad, they will give us signs like, I get headaches every now and then, or I can hear it in my ears, doc, when I'm sleeping, or I'm dizzy sometimes, when I'm really stressed and really upset. All these things, or chest pain is a big one too. So you want to make sure you watch out for those symptoms. And if you're having those, make the appointment to go and see a primary care doctor. Or you know what, get your own blood pressure monitor and start doing your own readings. Obviously bring it to your doctor first so they can teach you how to use them properly, because some of them, depending on how you use it, you can get very wide ranges in blood pressure, which may not be correct for you.
We do prefer the brachial one, the one that
the
goes
arm
up
ones,
the arm. A lot of people like the ease of using the wrist ones, but they're not as accurate and consistent. They're good, like if you're in a pickle using it, or if you had, let's say, if someone is having problems with using the cuff on the upper arm, because let's say they've had some surgery, they've some lymph nodes, a dysfunction, etc., that can cause swelling, then you use the wrist one. But the brachial or the arm cuff is definitely more accurate.
So risk factors. Let's talk. Age is the biggest risk factor for everything that we deal with. Obesity, obviously, the more fat mass you have, the more stress there is on your system, and the higher blood pressure can actually be. Smoking, I still don't know why people do that, but smoking is a big one. Smoking is very pro-inflammatory, vasoconstrictive, can cause issues with regards to your blood pressure as well. High salt diet or high sodium rich diet, basically eating processed foods, that's going to give you that. Lack of exercise, the sedentary lifestyle that we like, just the Netflix and chill people forever. Those are the ones that, you want to make sure you get up off your tuchus and go for a walk. Do something, do something active. Chronic stress, our type A personalities.
Chronic stress.
Once again, don't listen to what Dr. B says. I bring nothing but joy to the relationship. Nothing but joy.
Ashwagandha.
That's me. I'm the natural ashwagandha. Oh my gosh. And now testing. So ambulatory blood pressure monitoring. So have you ever used that, Dr. B, for a patient?
Yes, I've had a few patients who did that. So there are some patients that are affected by just the stress of checking their blood pressure. And so every time they sit down, put that cuff on, every time they feel that tightening of the, because if you've had your blood pressure checked, you know that the cuff has to be tightened to a specific degree to be able to check your pulse and read that blood pressure properly. So some people get anxious about that, and just checking it episodically is not the greatest. You see a lot, when you see it fluctuating quite a bit, then you know something is going on. However, the ambulatory blood pressure, typically there would be, so the way this works is sometimes some doctors will have one of these devices in their office that will give you to take home, because obviously for 24-hour, you're going to be taking it home. Or we can order it through a specific medical equipment store company, and they'll bring it out, or you go and pick it up and they'll show you how to use it. So basically a device that you put on, you walk around with, and it will episodically take the blood pressure. Yes, there is some tightening of the cuff, etc., but it's not, it doesn't create as much of the angst as you sitting down and putting it on and knowing, I'm going to check it right now. So it tends to be more accurate. And as the name suggests, we try to get you to wear it for 24 hours, and it produces it. You download the readings and evaluate that and see what your trend of blood pressure is throughout the day. It also gives you a good idea of what time of the day your blood pressure is higher, maybe more stressed, when you're coming home, cooking dinner, looking after the kids, stuff like that, whatever. And so it kind of gives you an insight into your day and what causes your blood pressure to go up and down.
So blood tests that we do, you want to definitely check a kidney function. obviously. That kidney is a big one. It's one of the main homeostatic organs in the body. Lipid panel is a good one. Thyroid is important. And then we also want to do some other endocrine testing, looking for other hormones if necessary. So you always start off with the basics, complete metabolic panel, a CBC, a lipid panel, just to kind of get an idea. Right. And if that doesn't yield an answer, and you're needing to start medications, then you and your primary care provider or doctor can go further and do some more testing.
They just give you kind of an idea if there's something going on.
Yes.
Like, for example, the lipid panel would give you an idea of maybe something heart-related is
might be going on, yeah.
If your cholesterol is really high, you may have some plaque buildup that we need to look at as an underlying cause of the hypertension. And of course, that leads you down a whole different road if you've got heart disease. So just to give you an idea of what we may be starting to look for, getting those baseline labs, and then obviously more testing to come. All right, let's talk about treatment. So, of course, lifestyle changes. We want to make sure that you're doing the best that you can to avoid any worsening of this condition. So we talked about what the risk factors are, which one of them was obesity and sedentary lifestyle. So exercise, absolutely. You want to get into some kind of regular exercise, whatever is appropriate for you. You can talk to your doctor about this for more recommendations. Weight loss, of course, losing the extra weight, if that's a factor. The DASH diet is a low sodium, high potassium diet. So as we said, high sodium diets, especially processed foods, can actually increase your blood pressure. There have been lots of studies that show that higher potassium containing foods or diets help to lower blood pressure. Stress management, of course, whether you want to choose meditation, breathing exercises, and other exercise too. So, if you want to do forms of yoga, Pilates, other things that will help to reduce your stress level. Meditation is a big one, absolutely. Medication. So, if you've done, let's say your blood pressure has been elevated a little and you've tried all those lifestyle changes, it's not coming down, unfortunately, it's staying elevated. We don't want you to have an event because of that. So medications, these are some common medications for high blood pressure. So ACE inhibitors typically work on the level of the kidneys to help to regulate blood pressure there. Beta blockers work on your those beta receptors in the heart and blood vessels. Diuretics, so there's some diuretics that helps you to get rid of the excess water that helps to lower your overall volume and blood pressure. And you've got some calcium channel blockers, that also helps with blood pressure reduction by targeting calcium channel receptors on blood vessels in the heart as well. And it's important when you're on any blood pressure medications to monitor your blood pressure regularly. That way you'll know if you need to increase or decrease your medications. And of course, going into your doctor's office so you can get that done regularly as well. You want to make sure that you avoid excess alcohol or no alcohol at all. As, Dr. G is very passionate about that. You want to decrease the amount of caffeine you're taking. There are people who drink upwards of 10 cups of coffee per day. And I mean like straight up caffeinated coffee. And so you have to be careful. Too much caffeine can definitely raise your heart rate, raise your blood pressure, give you headaches, and contribute to some other issues. Because it actually is a form of introducing more stress on your body by increasing caffeine. And of course, all those other lifestyle factors that we talked about that can increase your risk factors, salt intake, smoking. So just adjusting your lifestyle to help with a healthier blood pressure.
And we did talk about some medications that were up there. And let's just to go back. Everything that we prescribe as physicians has side effects. So what we like to tell our patients is if you can get away by making lifestyle changes and improving the health condition, do that first. Because the pill typically will give you a side effect. If not now, eventually. So anything you can do on your own to help make your health even better without the added poison that we give in terms of pills, please explore those options. Make a real strong, bold effort to improve your overall health and wellness, and you're going to see huge returns in terms of longevity, in terms of feeling better, without the worry of side effects. Like some drugs give you a cough, swelling in the legs, shortness of breath. And some of them even have sexual side effects like erectile dysfunction. Mm-hmm. And these are medications we prescribe on the daily for hypertension. So something to think about.
So what you're saying, Dr. G, is if I can control my blood pressure by just adjusting my lifestyle factors, that's much better than taking a pill for it.
Ding, ding, ding. That's right. That's right. You are absolutely correct, Dr. B. You know what you win? You win life with me.
Okay.
No?
All right.
That's not a big enough prize?
I will take it.
Wow. Let's move on to supplements then. I'm going to steamroll past that one because my feelings are a little bit hurt. I'm just going to steamroll.
Well, let's start with the fatty acids there then.
What who you calling fatty acid? You kidding? All right, omega-3s. Why do we like omega-3s? Because they lower blood pressure by reducing inflammation. So they are really good. And you can get in like I said, flaxseed, salmon, fatty fish. And they do overall improve heart health.
So we talked about potassium, which has been shown many studies to help to relax the blood vessel walls and help to lower blood pressure. Magnesium is another great one. I love taking magnesium because it has so many different benefits.
Tons.
It's actually been shown to increase the body's production of nitric oxide, which is it helps to dilate blood vessels, so it lowers the blood pressure. So magnesium helps with so many different things. That's one of the supplements that we're probably going to go into really deep on one of our episodes here, because I just love magnesium. And we have CoQ10 as well, which it helps within the mitochondrial level, helps to increase energy in the mitochondrial level, and it helps to support cardiovascular health. So people with high cholesterol, high blood pressure, heart disease, CoQ10 is a good supplement to take for that.
Now, one that we didn't mention here, but I came across in studying is hibiscus. So apparently there's a species of hibiscus which they've been studying in studies that can actually help to lower blood pressure. And it's because in the hibiscus flower, when it's boiled, the extract is anthocyanins. And what the anthocyanins do is they help to increase nitric oxide, and they also help to reduce inflammation within the body. And that can help with vasodilation, improving overall cardiovascular health, and improve blood pressure. So hibiscus tea, it's something to think about. You want to get that hibiscus, just kind of dry it up, crush it up, pour some hot water on it, filter, and just...
hibiscus is a very popular plant back home.
Yes.
Where I'm from, the Caribbean. And I remember as a kid, we would take the flower and take that little, what do you call that?
The stylet in the middle?
Yeah,
yes,
in the middle, and it had all that sweet substance. We
did that too.
Just sucking on that and extracting, and lots of the bees love that stuff. So
we would beat the bees to the flowers.
I know, we'd take away the food.
We're not playing. No.
So I guess that was all good back then. We're drinking the hibiscus.
I don't know if people who are who are deep into plants and making sure that we have enough flowers around would appreciate us doing that as kids.
We had excess.
Okay, good.
We had lots in our gardens. We would pass by the roadside. They were growing everywhere. They still do, I think.
Why would you say that on? Oh, wait, you ain't got to mention the hibiscus eating. Come on now. Jeez. She's kidding, people. She's kidding. We made sure the bees got their fill first, did the pollinating, and then we ate the flowers.
They were just fine. There were too many bees there anyways.
Oh, my God. Well, that does it for today's episode of Vitality Vault. We ended the note on eating hibiscus flowers.
Yes.
But not really eating them. So drinking hibiscus tea to help with lowering blood pressure. Hope you learned something today. Hope you are empowered to talk to your doctor, your primary care provider about your health, about your blood pressure, about things you can do to maintain health or improve longevity and improve your health span. Dr. B, any parting words for the public before we step out?
No, but I'm going to check my blood pressure after we're done here.
It's going to be low because her natural ashwagandha is sitting right next to her.
I'm going to go get some hibiscus tea right after.
Have a good day, guys. Thanks for joining us in the Vitality Vault.
Bye.
Thank you for watching and listening to the Vitality Vault with Dr. B and Dr. G. Don't forget to check out our other informative episodes as the doctors dive deep into your health and wellness so you can live a more vibrant life.